Good morning, everyone. So I'm kicking off the proceedings with a presentation on systems insights. So for those of you who are working in the health arena or care or public health or any other system, education, you will know that increasingly we need to focus on how it feels for the individual in the system rather than seeing a bunch of services just scattered around people and very much carrying on doing the sort of thing that they've always done. Cranbrook created an opportunity for us all to rethink our approach to how we plan for and respond to local needs. So just to talk a little bit then about Cranbrook's history. So from a Healthy New Town perspective, I've just put in a timeline here. One of the things that was really interesting about Cranbrook is one of our own public health team was involved way back in 2005 actually preparing a health impact assessment. So working, she was a consultant with us, she's a consultant with us now, Sarah Gibbs, but what she did was she was seconded into the Devon County Council planning team and worked with them to produce a report which really looked at the needs of a new town. And going back and reading that, and it's available on our Devon Health and Wellbeing website, it shows you just how much things have changed since that time. And some of it reads a little old-fashioned now, but actually some of the principles there are really, really critical to the work that we have been doing and will do in the future. So you've got the timeline there. You can see that you've got the establishment of Cranbrook Town Council. We, within public health at that time, were looking at a needs assessment. That was a bit of a challenge because one of the things that we rely on very heavily for data is the census. And of course, when you've got a brand new town, you haven't got data to use. So a lot of the intelligence that we've used in terms of thinking about the population, we've had to build up from different data sources. And that's a unique feature of the intelligence gathering for the Healthy New Town. It's a real challenge for us. But then East Devon District Council led the bid for Healthy New Town status. So as Councillor Chugg has said, one of 10 in the country designated as an NHS England Healthy New Town, and a unique one of the 10 in terms of its characteristics. And East Devon District Council kicked the work off, so some really good early successes. And then as NHS England started to firm up the requirements about things like new models of care, Devon County Council took over the lead, and I've had the pleasure of chairing the executive group for the last couple of years. And as Councillor Chugg says, there are some priority work streams, but that does not represent the entirety of the work that we've been doing together. Again, for us within Devon, many of you will know Devon's age profile is typically older than the national average in general, so we get a lot of inward migration, particularly to coastal areas of older people, because it's such a wonderful place to live, and our health and social care services are so good down here. But what is amazing about Cranbrook is just the difference. It has a completely different feel. The population profile, it's young people, families, children, so it's very, very different. And you can see that the comparison there, just how strikingly different it is. So that brings real challenges. So going back to what I was saying at the beginning about a systems approach, it's absolutely no point in just layering on the same old type of services. That we have to be very responsive in terms of the way we're thinking, because the population needs are so different. So what is a healthy new town? So I think some of the things that were occurring to me were one where the health impact is considered. So this is something that we don't do an awful lot, we don't get the chance to do, but it is really important to think about that. Thinking about, as Councillor Chugg says, that community culture, building a sense of community, building up social capital, which we know is good for people's health and well-being. Green space, also thinking about inclusivity, because it's about everybody being able to have the healthiest lifestyle they possibly can and make those social connections, and particularly intergenerational connections as well, because we know those are very important. And particularly when you've got a very young population, you need to make sure you've got those connections with older people as well. Then you've got considerations such as sustainable transport. You want an environment that's ecologically sound, and of course you need to think about the main determinant of health and well-being, which is income, wealth. And so we need to think about how we are building the skills and education levels within our population for the future, because that's the greatest chance we'll get to give people good health as they get older. And I've mentioned health and care services. So this is the Cranbrook Health Impact Assessment, and I love this quote, a good neighbourhood is a balanced neighbourhood. And overall, a good neighbourhood is one in which everyone feels ownership towards that neighbourhood and which encourages the adoption of more healthy, sustainable lifestyles. So this is back in 2007, but I think that actually is as fair to say now as way back in 2007. One of the things we do within public health is we're always thinking about people at the centre of a world which involves a whole range of things which affect people's health and well-being. And so one of the things we've been keen to do with Cranbrook is actually think about Cranbrook as a place as a complex system, because of the many aspects there are to different people's lives. And we don't want to see people segmented into users of health services or school children or young people attending college or people going to work or retired people. It's about understanding that all of these things, the environment in which people live, is really important. And in thinking about systems, many of you will be familiar with this idea that you've got very simple linear systems and then you've got complex systems which change all the time. So one of the challenges for us in terms of our partnership working, and all the partners who we've worked with would recognise this, that things change all the time, and so you're constantly having to alter the way you think about things to make sure that you're keeping on track with your emerging strategy. And thinking about what's known as a VUCA world, a volatile, uncertain, complex and ambiguous world. One of the things, this is a piece from the Harvard Business Review, so it's designed for the private sector, but actually the principles here about needing specialist knowledge to understand the complexity, building relationships, thinking about how you develop models of working, so prototyping, setting up a way of working and then testing it, seeing whether it works is really important. And finally, thinking about building understanding. So the lack of data actually is a bit of a challenge for us, and so our need to collect data and develop intelligence is really important. And again, you'll hear more about that later on today. So given all of this complexity, what's worked well? So first of all, I would say we've had fantastic support nationally. So NHS England has worked well with all the sites and has brought them together in different learning networks. So that's been a very different way that NHS England has operated. And so that creation of learning sets and expert seminars has actually helped us in Cranbrook, because we've been able to see what's been going on elsewhere in the country. And then thinking about that systems approach that I've mentioned, again, we've got a workshop later on about building relationships and working in partnership, which has been really important, good engagement, great support from both the county council, our colleagues there, the district council and the town council. So that's been a sort of three-level way of operating. Again, better use of linked data and predictive modelling. So we've had to really work hard to think about the information that we've got, and good governance. I think we've put in place really good governance arrangements. And I think even better if we'd been able to understand perhaps a bit more about what building a new town was like and get some of that engagement earlier. And I think, again, the NHS England publication, Putting Health into Place, will certainly stress that getting those agencies joined up at an early stage makes a big difference. And I think if the Healthy New Town programme had started earlier, because I think this is a brilliant opportunity, not just for towns, standalone towns, but also for the huge range of housing developments that are taking place, that are being generated across the country. The principles still apply. So everything that you will be learning about today, I think if you've got a new housing development, the principles still apply. And so we're very keen that that legacy, our learning, is continued into the future across Devon. And what difference has the programme made? I think you can see it, you can breathe it, you can smell it. I think you can see visible participation. Some fantastic work on sustainable transport, active travel. You've got all the green space we've heard about, community building, some really good focus points for the community. And these have varied at different times, but individual community leaders who have stepped forward and who've made a real difference to bringing people together, building place-based intelligence from big data, and also, I think, putting Cranbrook on the map through positive publicity. So I think, you know, the Tour of Britain really galvanised not just Cranbrook, but the whole county and wider, and I think we need to continue with that. So finally, just to say that in terms of how we go forward, George Edward Pelham Box, who was a very famous statistician, said the only way to know how a complex system will behave after you modify it is to modify it and see how it behaves. So Cranbrook is unique, and for us it is also the ultimate prototype. We can learn from it. Thank you.